Today is World AIDS Day. By definition, it's a time people across the world take time to remember those who we've lost to a disease that we have fought against for more than 30 years. When we talk about who is living with HIV and AIDS in today's world and who is most likely to be affected, the answer is not easy, because there are policy and public health consequences to that question. HIV and AIDS are not just gay men's health crisis, although there is that. And it's not just a rising trend among African American women, although it is that. It's a disease affecting us all. And the reason why we need comprehensive prevention, education, and care is because it impacts all of us. Those factors and more affect the rates of infection, especially among young people. According to a new CDC report, 6.7% of the estimated 1.1 million people in the United States living with HIV in 2009 were young people ages 13 to 24. 59.5% of those youth were unaware that they were even infected. And in 2010, those same young people were 25.7% of new HIV infections. But let's be clear. This is not because young people are just ignorant or they don't care, as evidenced by the 7 young AIDS activists arrested on Tuesday at House Speaker John Boehner's office after protesting in the Buff against proposed AIDS cuts. What we need, in addition to more funding, is more knowledge and more resources so that our young people are better equipped to protect themselves. At the table, Sonia Rastogi, Sonia Rastogi, an advocacy coordinator for the Positive Women's Network, who is HIV positive. Dr. Susan Ball, director of the HIV Care Center at New York Presbyterian Weill Cornell Medical Center. Joy Reid, managing editor of TheGrio.com, and MSNBC contributor Ari Melber. Sonia, I want to start with you first, because your work as an activist is to have these conversations with young people. What do young people need to know about HIV and AIDS?
Well, you know, I think what young people need to know, as you said, is that HIV is not a disease that's about ignorance. It's not, I mean, there is ignorance and there is stigma, but it's not about, oh, well, my behavior was so irresponsible, my behavior was so fill in your negative or judgmental comment. Our lives are a lot more complex than that, and it is about these structural issues such as prevention. So let's talk about prevention. For women, we do not have prevention tools in our toolbox that enable us to control prevention of HIV in our own bodies, for example. And so I think that that's a huge issue for you. I
mean, I think, you know, I want to pause here for just a second, because when we look at 13 to 24-year-olds having these kind of infection rates, and particularly the vulnerability of women to infection when they have sex with a HIV positive partner, I think we have to lay on top of that the statistic that women in that age group, particularly teenagers, are often having sex with men much older than them, and the coercive nature of those relationships is sometimes something that we're, I think, less willing to have very clear conversations about when we're talking about this.
Absolutely. And I'm really glad that you brought that up, because, you know, one of the focuses that we've been working on and that we've heard from women all around the country is this issue of violence against women and trauma, and the fact that violence against women, it doesn't just increase a woman's vulnerability to HIV, but after she becomes positive, it has huge implications for how she will do, how her health will do.
Susan, it feels to me like part of the reason that we end up with these rates is because the idea of just getting tested is not really part of our sort of annual, I mean, first of all, the idea that Americans are just running in having annual checkups is already naive. But even within that context, it's not as though we think to ourselves, okay, I'll go get, you know, my blood pressure checked and, you know, my annual pap smear. Oh, yes, and of course, my annual HIV test. Right. Is there a way to start moving young people towards testing as a routine part of medical care?
Well, the CDC recommends that all people who are sexually active and people going to their doctors get tested. And it's really a push for general internists and family practice doctors to test every patient between the ages of 13 and 65. I'd argue that you shouldn't stop at age 65, but certainly people who are sexually active at any time really should have an annual test, because among those more than 1 million people that are living with HIV in our country, more than 20% of them don't know their diagnosis. And as you pointed out, so many of them are young people.
So it feels to me like there's a bit of a different political valence in this moment than there was in the early 1980s. So, you know, I still think of myself as a young person, but increasingly less so, because I remember a world in which there was no HIV, and then I remember the introduction of HIV into our political consciousness, and I remember that sense of it's a gay man's disease, and it's we should be afraid to touch or talk or go to school. And now we have the White House with the beautiful red ribbon in context of World AIDS Day, and yet there's still something about the discussion that has over it a kind of pall of politics that is not like cancer or diabetes or some other medical condition.
Yeah, it still doesn't feel mainstream. And I mean, the irony is that among the gay community, particularly among white gay men, the spread of the disease has actually declined enough to where the activism isn't so much there. And where it's moved into are these communities of color. I lived in Florida for a long time. You look at a community like Liberty City in Miami, which still has epidemic levels of HIV infection, particularly among young people. You just see this convergence of forces. You see poverty. You see high rates of post-incarcerated people moving back into the community, many of whom are infected and don't know it. You see a lot of what you guys were talking about, coercive relationships. There's actually new studies that are showing, even things like dating violence and, date rape starting to play into these increasing incidences among young women. So you see that HIV and AIDS is being concentrated more and more in the most politically disconnected community, the communities that have the lowest rates of voting, that have the lowest rates of activism, they don't get the attention of politicians. So I think there's a sense in which HIV/AIDS has become less of a flashy political issue, it's become more of a poverty issue.
Yeah, and so let me pause right there, because I think that feels to me like part of what's happening is that this obviously poverty does not cause HIV infection, but the interrelationship between poverty and new infection, as well as once one is managing the disease, and then the questions of poverty that emerge. Talk to me a little bit about that connection between poverty and HIV.
Yeah, absolutely. I mean, poverty can be a driver of HIV for all the reasons that we were talking about, where poverty can put people into situations that they may not want to be in, whether it's coercive relationships or whether it's other types of things. But our current healthcare system incentivizes people to stay sick. It incentivizes people to stay on benefits and to be disabled in order to get services, in order to take your medication, in order to be able to have a healthy life. And that perpetuates this cycle.
I do not want to miss that. Can you explain the Medicaid link and how this creates this incentive in a certain way?
Well, in terms of accessing care, Medicaid, as we were mentioning during the break, we have in New York State, for example, Medicaid we say is the best insurance money can't buy. Because with Medicaid benefits, people get access to all their medications, their doctor's visits, their hospitalizations, as well as a ride to and from the clinic with visiting nurses' care. And sometimes patients are afraid to get a job because they might lose that benefit. That's terrible to think that someone would get out of their care and lose their benefits if they were really working. And
yeah.
That's a big problem.
Yeah, so we'll go to break and we'll come back on this, but this was sort of one of those aha moments for me, recognizing that now all states are not quite as generous on Medicaid,
right.
But if you have, before ACA passes, right, if you have an HIV positive diagnosis, you then cannot access new health care because you had a pre-existing condition,
right.
Which meant if you were in a circumstance of, it was actually better to have to live below the poverty line in order to be able to access Medicaid, because in order to pay out of pocket for these, you'd have to be making $250,000. So every other like normal job in the world in the middle actually meant that you didn't have access to care.
Right. And just to add to that, just think about the message that sends to
Yeah.
people. It's better to be below the poverty line in order to have a healthier life. What does that say about my self-worth and my value as a person?
And what does that say about who we are? And I mean, it's the one thing that ACA, for all of its shortcomings, the fact that it addresses that pre-existing condition really matters. But I want to stay on this in a bit. But when we come back, we're also going to talk to an actress, an author, and AIDS activist, Sheryl Lee Ralph. She's joining us next. She's a fabulous actor and an amazing activist.